I think it's very important, especially when you work with people with brain injury that is from different cultures. One of the more important things is to work with the family and also talk with all the family members and provide them information about the recovery, about the prognosis of the disease, and also, ask questions to them and ask them what do they think about the treatment, if they have suggestions. We talk with the family. I think it's very important. In some cultures, we don't use the informal consent, the informal consent form. Usually when you go to the doctor in other country, you don't expect that you have to sign a consent form. And some cases here in this country, when people from Hispanic background or people from Asia go to the doctor and they see that you have to sign an informal consent form, they start thinking about that there's something weird here, there's something wrong, why I had to sign and give authorization to my doctor to provide service to me. And this is one example. Other example is that, for example, some minority, some people from different cultures think that the things that happen with them in terms of health problems is related to God. And when they have a TBI or a spinal cord injury or other kind of disease, they think that probably it's God, the person that, caused this thing or send that problem to him, and they don't want to do anything to change the situation. They hope that God will help them to recovery, and they don't feel the need to go to the rehabilitation professionals to receive services. For example, I can tell you that we have patients, sometimes Hispanic patients, that they, when the doctors prescribe the medication that they have to take, they don't want to take the medication. They talk with their family members, especially with their mom or grandma, and ask them for advice. And ask them is this medication is good for them, or if there is something else that they should take instead of the medication that the doctor recommends. And sometimes, they think that this God, the person that is the only person that can provide services to them, and you have to work with them and show them that, God wants him or her to recovery, and God is working with the rehabilitation professional to provide service to him to improve their lives. One of the advice that I can give to the families is that they should be persistent. They should try very hard to find professionals into the community that will be able to provide services for their family member. There are a lot of professionals in the community that speak different languages that will be willing to provide the same service that they provide for people in this country to people from other countries that doesn't speak the language, that don't speak English.